tongue is actually supposed to act as a palate expander, basically holding the shape that your palate is supposed to be. So it's supposed to be, you know, kind of wide so to accommodate the whole tongue. And when that tongue is not up there, what happens is the bones of the palate start to go upward.
Are meal times a serious struggle? Does your child eat a limited number of foods? Does your child eliminate entire food groups? Are you tired of waiting for them to just grow out of it? Welcome to How to Unpicky Your Picky Eater, where you'll learn strategies to help your picky eater expand their palate. With Christine Murati Yoder, a pediatric feeding specialist, speech pathologist, mom of a child with feeding issues, and author of Mealtime Mindset. Let's get started. Here's Christine.
Thanks so much for joining us. Today, I have one of my favorite topics to chat about, actually. And I think it's because I had such a personal experience with this topic myself that I love talking about it. Because when I first found out about it, it was very life changing for me. So I love teaching others about it and having it be life changing for them as well. Um, so the topic is tongue and lip ties. And this is something I was born with and something my son was born with as well. Um, and it wasn't in my awareness. It definitely wasn't in part of my training in undergrad, in graduate school, when we're learning to become speech pathologists. It just wasn't something was that was part of our education. Um, and, I can't really answer for why that was, but I'm very grateful for all of the postgraduate education and courses that I've taken with people who are like true experts in this field. And I have learned a tremendous amount about tongue ties and probably more than I've ever needed to know about ties. Um, so I'll just kind of I guess maybe I'll start with my personal story, right? So it didn't come into my awareness until my son was born and until I started breastfeeding him. Um, Now, I had a wonderful doula, and she was right by my side right as soon as he came out. And she said to me within like 5 seconds of him latching on, I think he's got a lip tie. And I was like, what? Oh, no, he's perfect. He's latching and it feels good and I'm comfortable and everything's okay. Um, but that was the only time that I was comfortable breastfeeding, and it was probably because of so many hormones and, I don't know, I had an epidural and there was, some drugs in me, so who knows? But whatever the reason, I did not feel any pain at that point. But very shortly after that, because babies nurse like all the time, they're constantly hungry as soon as they come out. And it is their job to be hungry. Like that is their job is to eat when they are an infant. So, he wanted to eat all the time. And it was really uncomfortable. It was really painful. I felt like he was just not satisfied. He wasn't hungry or he wasn't getting what he needed to not feel hungry anymore, I should say. And, the lactation consultant at the hospital was not very helpful. She showed me a few positions that I should try, which helped a little bit. But generally, she was more or less like, you'll toughen up a little bit and it'll be fine. Like the baby looks fine. There's nothing wrong with him. So it was definitely not caught at the hospital level for sure. Um, then, I was just struggling so much. And I had my doula come back and I was like, please help me. I'm struggling. Like I was in tears trying just to feed the baby. And it was so uncomfortable. And he was so upset. And I was so upset. And we were everyone in the house was miserable. And I just so wanted to have that feeling of, like euphoria, like, "Oh my gosh, my baby's here. It's this moment I've been waiting for." And I was miserable. Like, we were all miserable because this feeding thing was happening constantly and it was not going well. So I, uh, she came over and I was like, "Can you just take like a closer look at him? I know you mentioned something about ties, but like, can you just take a look again?" So she looked again and she was like, "I definitely think he has ties and you should definitely go see Dr. Siegel, who is in New York area. He's a well-known facial surgeon that deals with ties, right? That's like his jam. So I went to go see him, and I booked an appointment. I was like, let's get the next appointment. Like I was like, if there's a solution to this problem, I'm gonna do it. I was very, very determined not to switch to a bottle. And I really just really, really, really wanted, like in my soul, to make breastfeeding work. I knew how important it was, and it just became very important to me to see this goal through. So I was not going to let like tongue tie deter me from feeding my child. So I was like, all right, great. We're going to get this fixed. We're going to do it. So I go there and he shows me, yeah, he has a tongue, he has a lip tie. Um, and he kind of explained the procedure of what it happens. I was allowed to be in there and he said as soon as you're done, you're going to nurse him right away in the next room. And there was a really nice nurse that also helped me get him latching, get him comfortable. And it was a really quick procedure. It was about, I don't know, 20 seconds long. He didn't need to be put under or anything. The staff was just so kind and gentle with him. And, of course, he was upset. There was a bright light in his face and he was being held down and he didn't know these people. And, at this point, we were like a month in, like he was a month old already. So, yeah, he was upset. Of course, he was upset. But, after that 30 seconds was up, he was back in my arms and I was very quickly getting him latched. And, once he settled down, he was much better. He had like I'd say a tougher 24 hours. He was uncomfortable. I gave him some homeopathic teething medicine, camellia, and that seemed to help him a bit. And but I felt the second he latched, I was like, oh man, this is great. Like it was a good, secure latch. Like I could feel it. I was like, I've never felt it like that before. Like it felt so different. And I remember just being like, oh, this is why it's supposed to be easy. It's supposed to feel this easy, right? So then the hard part came where you have to do these stretches under the tongue so that it doesn't reattach. And the reason is you don't want it to reattach too quickly. You want it to heal, of course, but you don't want it to reattach where it was. You want it to heal further back, where it's, I guess, more or less supposed to be. So you have to do these like very unpleasant stretches. And I wasn't prepared to do them very well. And it's because I still did not at that point have enough knowledge. Now what I know is that I wouldn't just rush into getting that release without doing the pre work first, those exercises beforehand, setting him up, making a routine, making it into a game. So it's not this unpleasant, me holding you down, pushing your tongue up experience. Because, yeah, it is unpleasant, but like the kids that do that work first, it is a much, much, much smoother, less painful, less aversive experience for them. So, um, you know, that was kind of our experience, right? But now I just want to take you back a little bit to, why they do impact and what's supposed to happen. So, I know you can't see. I have a video that you could watch on YouTube of me recording this podcast. And I have my mouth kind of model that I use to explain this to parents. But where your tongue is supposed to be in your mouth, whenever you're not speaking or eating, is up right behind your top front teeth, not touching your teeth. There's these little like bumpy ridges that you can feel. Like if you feel it with your finger, your tongue, you can feel that. And when you feel that, you want to go just a little bit behind where that is, almost like where it starts to there's like a little sloping. Like that's kind of where you want your tongue tip to rest, right? So in the mouth, you're going to have that tongue come back, and that's where it's supposed to be. So when you're sleeping, when you're just chilling out, resting, your mouth is supposed to be closed, teeth ever so slightly apart, and that tongue at that very spot. And with a tongue tie, what happens is it's like a little rope pulling down on the tongue and keeping it low in the mouth. So keeping that tongue down here by the bottom teeth. And that is something that happens from birth, from like 12 weeks gestation. So it's something that, it's not like, oh, wow, like I wish I could have prevented it or something. Like there's really no way that I know of to prevent it from happening. Um, but I do know there's a genetic component, right? So everyone in my family seems to have one, and my husband's family, they don't. They have like perfect mouths with perfect teeth. That's the craziest thing. But I'll explain a little bit more about how the teeth impact in a second. But so what happens is if our tongue is not up at the roof where it's supposed to be and it's low, it actually cre- uh, it results in the palate misforming. So your tongue is actually supposed to act as a palate expander, basically holding the shape that your palate is supposed to be. So it's supposed to be um, you know, kind of wide to accommodate the whole tongue. And when that tongue is not up there, what happens is the bones of the palate start to go upward. So they become high, and your palate becomes high and narrow. And that's what we see in babies, right? That's something I'm looking for. Where is their palate? How high is it? Because, there's just that one bone in the palate that separates the mouth from the nose. So there's nowhere for that bone to go other than into the nasal cavity. So at some point, it's going to cause issues like snoring or sleep apnea. Um, you might not be getting great oxygen flow. If you are nasal breathing, you might not be getting what you should be getting because there's an obstruction. There's some sort of a blockage, and the blockage is your palate, that bone. It's not where it's supposed to be. So that's what's supposed to happen. Your tongue's supposed to be up here, forming your palate shape. And when it's not, it's low in your mouth. And when it's low in your mouth, your tongue actually starts to compensate in all sorts of weird ways. But the most common way that I find that your tongue compensates is for the swallow. Instead of swallowing back, so you're supposed to actually do like a suction and swallow back the food. So tongue tip to that spot, and then the back of your tongue comes up and you do one swallow. But what ends up happening is you end up with the tongue thrusting. It'll thrust forward like this. So a lot of people with tongue ties have a tongue thrust, which affects your teeth when they come in. So some people, that tongue thrust is so strong, right? There's 8 muscles in your tongue. So there's a lot of strength there. So they'll actually push the teeth forward. A lot of things can happen with ties. Sometimes because of the tie, it narrows the airway in the back because that tongue, instead of being up, it falls back into the airway and it makes the airway narrow. And when that happens, now your anatomy can do a few things. You can actually have sleep apnea. You might wake frequently, have bedwetting incidences, very restless sleep, trouble getting to sleep. Um, or sometimes your anatomy will actually shift. That jaw will actually come forward and you'll develop an underbite because the jaw moving forward means that you have a wider airway. So your body will actually fix the problem in a different way. But it's not good because you shouldn't have an underbite. It's actually very uncomfortable. It's just not how your mouth is supposed to be formed. Um, and how it relates to our picky eaters, I find, and I found this to be true, at least in my practice and what I've seen, all the people that come through my clinic, is that when your tongue and your jaw, right, they're not doing what they're supposed to be doing, essentially. And they start to remember I said there's compensations, right, that develop. Um, and There it leads to weakness of the tongue and the jaw, instability, and when you have that, you have trouble moving food around in your mouth. So what you're supposed to do is you're supposed to be able to, take food in, move the food over with the tongue to the molars on the right, move the food to the left, and then the food is supposed to come back onto the tongue into the middle part of the tongue, okay? And you're supposed to swallow it back in one swallow and clear your whole mouth. So when I look and we do this with our kids who are picky eaters, when I want to look in their mouth after they swallow, I see food on all parts of the tongue. A lot of times, if they have a stronger side, that's where the food is lingering, because that's where they're chewing, because it's their stronger side. So that's where they default to. Um, Sometimes it's all over the tongue, sometimes it's more in the front, um, but usually there's remnants left over on the tongue. And that's how I know the tongue is not doing what it's supposed to do to move food around. And I believe that when the tongue is not moving the food around very well, it can create a negative feeling towards that food subconsciously. Because, so like, okay, let's say there's some food left on your tongue, right? And you don't even know it's there. But all of a sudden you feel oh, like there was something there. Now there's food going down, right? You feel like almost this fear develop of that food might not be safe because I felt it, or it made me feel uncomfortable. I can't even put like an exact word or phrase to it because everyone might perceive it a little differently. But what I'm thinking is that it's basically the subconscious mind taking that instance and saying, "No, that's not a safe food. Don't eat that again." And then you start eliminating those foods from the diet, right? So, when there's poor tongue control because of a tie, I can see how that would lead to picky eating. Now, are there kids with tongue ties who are not picky eaters? Yes, absolutely. It's not a guaranteed that because you have a tongue tie, you're going to be a picky eater, but I'd say it increases your chances. And I would also say that, while it doesn't necessarily mean you're going to be a picky eater, it does not mean you're not going to have any problems when you're older. Like I said, a lot of people have TMJ, jaw issues. They develop sleep apnea, snoring. Um, Most all of them need orthodontic work at some point because there's crowding or an underbite or an overjet, or there's that tongue thrust, so there's like an open bite in the front or on the sides. Um, So having a tongue tie could lead to issues later on. It could also lead to speech issues, right? So that tongue thrusting coming forward, that's exactly what happens when you have a lisp, because that tongue will come forward instead of back for the S sound, right? Same with that R. The R's are very tough with tongue ties because you need to retract the tongue. And if it's tethered, it's going to be harder to pull the tongue back to the spot it needs to get to make that good R sound. Now, of course, there's other ways to make some sounds, right? We could kind of teach you some strategies or how to make it sound close enough, right? But it usually doesn't eliminate the underlying problem of the tongue is not where it's supposed to be in the mouth. The pressures in your mouth are off and it's affecting the structure, literally, of your face, right? Because all of the bones in your face are connected. So when one bone is off, it throws off all the bones in your face. So there is a very big connection with ties, speech, feeding, teeth, and orthodontic issues. So, it is really important. And, I've heard people say that it's a fad, that it's not, it's just, it doesn't affect anything. There's no evidence, right? I've heard all of these arguments before. And, some of them are from other SLPs, some of them are from other professionals. And I'll tell you, they probably don't have the full education on the ties. That would be my best bet because I feel like once you do, you can kind of put all of these pieces together. It makes a lot of sense. And when you do, a treatment from start to finish where you're remediating them and you see a huge difference, it's hard to say that it's all made up and it's fake, right? Um, you know, you couldn't have told me, you could not have convinced me that it did not affect my son's breastfeeding because it was an instant night and day difference. And you do hear that with people. Some people say they didn't see any change. They didn't nothing changed. They didn't feel any different. To that, I would say that might not have been your main issue, right? We assess a lot of different things when we're looking at feeding. You might have a tongue tie, but it might not be the main reason, right? Sometimes there's a stronger sensory component, sometimes there's a stronger gut component. Um, and that's why we have to look at all of the pieces of the puzzle because every person is going to be a little bit different. So you can't just blanket say, well, you have a tongue tie, so you're going to have all these issues. It affects everyone very differently. And that's why not everyone with a tongue tie is going to be a picky eater because their psyche might not tie that ooh discomfort to a fear, and they might be able to overcome that and be like, yeah, that was uncomfortable, whatever. Right. But like, just as I can't say, you know, I don't, I get like nervous when there's a bug in my house. Some people have them as pets. So, I can't understand, the logic of me being afraid of a spider and someone going out to buy a tarantula. Like that doesn't make sense in my head, right? But that's why everyone is so different. So just because someone has ties, it doesn't mean they're going to have all these problems. Just because someone has ties doesn't mean we're going to need to release the tie, do any procedure, because we might be able to overcome that with myofunctional therapy, with some oral motor treatment, with orthodontic treatment. It might not be necessary. And I've treated kids where it wasn't necessary. In just a few sessions, we were able to reverse their tongue thrust. Just with doing a few exercises and practicing the correct swallow, they were able to get it. But sometimes with kids, or even adults, sometimes there's a wall I hit where I'm like, oh, we're not making any more progress here. I think we're going to have to release. And that's when, we'll send for release. But it's never the first thing I do. There's always the therapy that should come first because like I said, there's work to be done beforehand, and you really have to get a very good detailed assessment that's going to tell you exactly where all of the issues are and which one do we feel is the main contributing issue at the time. And if we can't remediate it, then we have that option to release, which is wonderful. Like, that's amazing that we have that. Um, and, just like a little background in it, when I was learning about this, and, people were saying that, oh, it seems to be so much more prevalent. My mom or grandmother, like, no one ever heard of tongue ties. Like, that wasn't a thing in the day, back in the day. But so what happened apparently, um, and, you know, correct me if I'm wrong, but this is what I've heard several times with different educators as I'm learning about ties, right? So they said, there was a shift in time where people were delivered via midwives versus gynecologists, like doctors, right? So back when midwives were delivering all of the babies in the world, midwives had that knowledge or training of ties. And at birth, they would check for them and just snip it right with their long fingernails. And that just freaked me out. Um, but apparently they just they took care of it right away. Whereas that seemed to have gotten lost in translation when doctors took over, and that was let go. So doctors weren't looking for it, they weren't snipping, they weren't doing any of those things. So what did they do? After the baby was born, if the baby had difficulty breastfeeding, they said, just give them a bottle, right? And so a whole generation, actually I'd say 2 generations, because my mom was the same. They would say they just told my grandmother, "Oh, just give her a bottle." And same for me. "Oh, she doesn't like breastfeeding, I guess. Just give her a bottle." Which is not true. Right, I know that now, but we didn't know that then because they were just told by their doctors to give them a bottle because bottles are easier. You can find different shaped bottles. At some point, you could probably find a bottle that'll work, which happens often. And then it seems to have been fixed, right? Quote unquote, but it's not really fixed. It's just a band aid. You've put a band aid on the problem. Um, You've circumvented the problem in some way, but the problem still exists and it will cause havoc later on, as evidenced by all of the orthodontic work that I needed, the night guards that I needed, and then as an adult, needing help with it again because after all of my orthodontic work came off, my teeth started to shift back. And why? Because the pressures in my mouth were still wrong. They were still off. I never fixed the underlying problem. So hopefully, I've given you some food for thought with this episode, and hopefully you've learned, a little bit more about the history of ties and, even my history with ties. And I really hope, you share this episode with someone who is struggling with breastfeeding or who's struggling with their picky eater, because a lot of times it's just missed. And like I said, it wasn't in my training. It's not in the training of a dentist. It's not in the training of a pediatrician. It's not anywhere unless you seek it out, unless you learn about it on your own, you're not going to necessarily come across this information. And, like I said, it doesn't affect everyone the same way, but for someone that it is affecting very severely, this could be very helpful and life-changing as it was for us. Um, and as an adult, I've had my tongue ties released and I've had so many changes. My mouth, actually, the teeth started to shift back to what I would say would look like almost a perfect mouth, except my jaw was, I guess, more permanently more forward because of my narrow airway. So that's, I don't know, we'll see. I'm getting myofunctional therapy for myself. And I've reversed my tongue thrusting swallow. So I now swallow correctly. And actually all of like I've actually been able to move my head more easily. I'm able to close my lips better. I had like an open mouth posture most of my life, and I don't anymore. So I know I've seen some benefits, but it's not without a little bit of work. I'll say that. Definitely take some work. But I really want to thank you for joining. Please reach out to us on Foodology Feeding on Instagram. We are on the internet, foodologyfeeding.com. Lots and lots of resources there for you as well. And yeah, thanks for joining. Hope this was really helpful. Please rate, review, and subscribe to the podcast. It really helps us out. And thanks again. We'll see you next week.
Thank you for listening to How to Unpicky Your Picky Eater. To learn more about achieving your child's feeding goals, check out Christine's website at foodologyfeeding.com. And be sure to tune in next time to How to Unpicky Your Picky Eater.